second year we have started this chapter with a definition of ergonomics and a definition of occupational therapy, and next topic that was macroeconomics. And we have defined the microeconomics process and the main concept of macroeconomics. Now we have another topic, that is using a team approach to identify and fill the gaps. Boys and girls, this topic is all about how to apply the macroeconomic process, and before we apply a new process, that is macroeconomic process, we have to study the the old method. So to study this old method, and we need some consultants and having background in preventive medicine, having experience in kinesiology and exercise physiology. So these consultants are supposed to find out the gap between the current practice and the macroeconomics. So these consultants will find out the existing structures, procedures, processes evaluated by supervisor, subject matter experts, will find out the current practicing process, structures, and procedures. And we are doing this to find out the gap between the current practice and macroeconomics. So we have previously we talked about that case study that was to reduce the chances of musculoskeletal injury in army trainees. So this process is to find out the gap between current practice and macroeconomics, and also to identify alternate method of injury identification and early treatment for that injury. So the main goal is to develop best practice scenario for physical therapy and for supervisor and for trainers. Now, to evaluate the old system, the conventional method that is in practice right now, we must integrate the community process. And how we can integrate that community process? We can track clinic visits as well as reason for these visits. We are able to identify the type and severity of injury. And in order to put targeted intervention program into place, we must need some changes. These changes are significant organizational changes, like increase in public awareness and changing in policies, changing procedures. So after application of this targeted intervention, there is significant reduction in medical clinic visits, that is 36.5%. Okay, boys and girls, we all know that the economic practice involves multiple disciplines, and these disciplines are physical therapy, occupational therapy, and ergonomics itself. So each discipline has its own role, and so now the next topic is the role of physical therapist and occupational therapist. So they have different role in macroeconomic approach, as both discipline has its own unique skill and unique expertise. So the role of main role of physical therapist is to treat the musculoskeletal problems, and by applying therapeutic intervention, assessing the patient, and then application of therapeutic intervention. So most PTs, most physical therapists do not take consultation job that require true macroeconomic practice. So they have their own role, but However, few physical therapists studied organizational effectiveness and work behavior. So, psychosocial context of work performance from a system perspective. So, besides doing its own expertise, a few physical therapists also studied psychosocial context of work performance, and they have their own unique role in it. So, just as ergonomists are quite little familiar with how to develop a learn or to develop a therapeutic plan of care, so as physical therapists are little familiar with macro ergonomic practice. So each discipline working in collaborative manner has its own unique knowledge and expertise, and working in collaboration. Now a few principles for better application of ergonomic approach. Ergonomics approach is to assess human capabilities and limitation, and then setting procedures and design which are most suitable for them. So the principle number one is all relationship within an organization are reflected throughout that organization. Here example is different systems are best for different group of people, like hierarchic system and flat system, which is suitable for different classes of the individual and different organizations. So here there is a approach that is balanced scorecard approach. This approach help each individual and each person and section to know their role, and then how they can contribute to the good of the whole organization. And the principle number two is every decision should be made according to the results made after assessment of the organization. Assessment results drive the design, and there are different ways of assessment like formal and informal interviews and surveys and system reviews and all that.